United States, motor vehicle crashes are one of the leading causes of death for children over the age of 1. The CDC estimates around 46% of car seats and booster seats are installed or used incorrectly. However, research has shown that using belt positioning booster seats with lap and shoulder seat belts instead of seat belts alone reduces the risk of serious injury by half for kids ages 4 and beyond. First, remember to keep your child in their 5-point harness until they have reached the max height and weight for that seat. Once they have met the maximum height and weight, it's time to move to a belt positioning booster seat. A belt positioning booster seat raises your child so that the shoulder and lap belt is properly positioned across the center of the chest, resting on the shoulder properly and low on the hips, touching the thighs. In a crash, the belt will protect and restrain the child as it was designed to do. Children should stay in a belt positioning booster seat until the vehicle lap and shoulder seat belt fits properly, typically when they have reached 4 feet 9 inches tall and are between 8 and 12 years of age. Moving your child out of a booster seat too early can result in serious injury in a crash. Boosters need a vehicle seat with both a lap and shoulder seat belt to work correctly. Never use a booster seat in a seating position with lap belt only. This includes on airplanes or public transportation. There are 3 types of belt positioning booster seats. First is a booster seat that has an internal harness, known as the combination seat. These can be used with the harness until your child reaches the maximum harness weight. Without the harness, it can be used as a belt positioning booster seat up to 100 through 120 pounds. Check the manufacturer's instructions for the weight and height limits on your seat. Second is the high back belt positioning booster. These provide additional head and neck support to the child as they continue to grow. Important: if your vehicle or particular seating position does not have high seat backs, headrests, or head restraints, you must use a high back booster in these situations. Third is the backless booster seat. This must be used in vehicles with head restraints, high seat backs, or headrests. We recommend the use of a high back booster when possible for added head, neck, and spine support. Belt positioning booster seats are easy to install. Of course, you still need to read your vehicle's owner's manual and booster seat instructions, but here is some general advice on installation. The right place for a booster is anywhere in the rear seat that has a lap or shoulder belt. Backless models like this one should only be used in seating positions with a high seat back or headrest. Have your child sit in the booster seat. Pull the lap and shoulder belt across their body. Buckle it and make absolutely sure the shoulder strap stays in front of your child. Always use both lap belt and shoulder belt. If your vehicle doesn't have shoulder belts, consider using a child safety seat with a higher weight harness. Lap belt guides are cut-out grooves on the sides of the booster that help make sure the lap portion of the seat belt lies below the hips and touches the thighs. Use shoulder belt guides only if needed. A shoulder belt positioner on the side of the high back booster may be needed to guide the shoulder belt across the center of the chest. Check your booster seat manual to see how to thread the shoulder belt through the positioners, taking care not to pull the belt off the shoulder. Some backless seats come with a strap to help position the shoulder belt correctly. Depending upon your child's size, you may not need to use the positioners for a good fit. The shoulder belt should cross the center of the shoulder and chest and should not cross or touch your child's neck. The lap belt should fit snugly below the hip bones and against the upper thighs. It should never rest over a child's belly. Seat belts and beyond. Many parents may be eager to move their child to a regular seatbelt on their 8th birthday. However, some children may be able to pass the seatbelt fit test on their 8th birthday. Others may need more time to grow before the seatbelt fits safely and correctly. If the seatbelt does not fit correctly, the child still needs a booster seat, regardless of age. Kids come in all shapes and sizes, so every child's needs are a little bit different. Here are some things to consider when testing your child's fit to a seatbelt. Number 1. Can your child sit with their back against the vehicle seat? Number 2. Do your child's knees bend in front of edge of the seat cushion? Number 3. Is the lap belt sitting low across your child's hips and touching their thighs? Number 4. Does the shoulder belt sit against the middle of your child's shoulder? Number 5. Can your child stay seated correctly like this for the entire trip without slumping? If you answer no to any of these questions, your child likely still should continue in a booster seat. Remember, NHTSA recommends your child ride in the back seat until age 13, as it is the safest location for children. If you need help installing your car seat or would like to have your car seat inspected, contact us. The Safe Kids team at Prisma Health are nationally certified car seat technicians and are here to help you at any time. We also have many community inspection stations who are available to help as well. Contact us for a list of certified inspection stations in your area.